We're very fortunate in the UK that since 1999-2000 we've had a network of local stop smoking services freely available at point of access to all smokers who want to stop. The first in the world to have that, and still the only one in the world really with a very comprehensive stop smoking service that's integrated with primary care, with mass media campaigns, with colleagues who work in tobacco control. So we're very fortunate in that aspect. If we took 100 smokers and they tried to quit cold turkey, then 12 months later, 2 or 3 of them, that's all, would still not be smoking. Now, with behavioural support from a local stop smoking service and with use of effective medication, we can get that up to 20 out of the 100 at 12 months. Most smokers who contact their local stop smoking service will be seen prior to their quit date, on their quit date, and then followed up for at least 4 weeks after their quit date, sometimes as much as 12 weeks. And that's to help the smoker choose the right medication, get the most out of the medication, but also to cope with learning to live without cigarettes, to cope with the urges to smoke and the triggers that they get from the normal situations where they would have had a cigarette. Smokers in the UK have the option of using stop smoking medications which are very effective and cost effective. And these are nicotine replacement therapy, such as the nicotine gum, the nicotine patch, the nicotine lozenge, the mouth spray, and also varenicline or Champix, which is available on prescription. In fact, all of the medications are available on prescription, so for those people on low incomes, they can get those free. But nicotine replacement therapy is also available over the counter at pharmacists or on general sale in supermarkets. We're conducting research all the time to find out better ways of helping people stop smoking. And there's some very sort of promising advances at the moment. One is sort of preloading, which is using something like nicotine replacement therapy, the patch or the gum or the lozenge, 2, 3, 4 weeks before quitting. Just so that the smoker gets used to taking the medication, they get used to the side effects, the taste of it, but not whilst they're trying to actually stop. So they have a period of 2 to 3 weeks before they quit where they get used to the medication, they practice in essence, they find that it's effective, they have confidence in it. So when it comes to their quit date, they're already used to the medication, they just need to up the medication and stop the cigarettes. The biggest problem about nicotine replacement therapy and Champix is that people have an unrealistic expectation about them. They expect them to be a magic bullet, that they will take them and they will not want to smoke at all. And it doesn't quite work like that, unfortunately. The medications work differently for different people, but what they are is an aid to stopping smoking. But as well as the medication, people will need behavioural support from a trained practitioner. They'll also need support from their friends and family. They need to change their routine, and they need a bit of luck as well, and certainly lots of motivation. Stop smoking interventions are incredibly cost effective because the dangers of smoking are so costly to society, not just to the individual, but they're costly to society. Triple heart bypasses cost an awful lot of money. If we can get someone to stop smoking before they need that, we're in fact preventing that triple heart bypass. So stop smoking interventions are not only effective, but they're cost effective, and in fact they're one of the most cost effective interventions that the NHS has.